Alright, Assalamualaikum. So today we'll be covering the last chapter of AS level biology, infectious diseases. It's a very easy chapter, and all you need to do is you need to learn few diseases that we'll be covering: cholera, TB, malaria, and HIV. Four of them, and then you need to learn who is the positive agent, how can we prevent that particular disease, how can we treat that disease. So this is it. These are few basic things that you need to learn about this chapter. And each year CA gives any one of the diseases in particular. So it's an important chapter, yet it's very easy. All right. So infectious diseases are diseases that are caused by organisms known as pathogens. So they might ask you this in your MCQs, that how are infectious diseases caused? So you need to mark pathogens at that point. Yeah. Then they are sometimes called communicable diseases, meaning they can be passed from one person to another or from one infected person to another uninfected person. And then there are also those diseases which are non-communicable. Okay, so at this point, we'll be doing we'll be doing the diseases that are communicable. Then a disease is an illness or disorder of the body or mind that leads to poor health. And each disease is associated with a set of signs and symptoms. So they ask you this definition of diseases for 2 marks. Okay, and this is exactly what you need to write. Do not write anything else other than this, because this is directly extracted from your marking scheme. So you need to mention that it is an illness or a disorder of your body or your mind, and it causes your poor health, and each of them is associated with certain sort of signs and symptoms. All right. Then these are the diseases that we'll be covering: cholera, malaria, HIV, TB, and measles is no longer in your syllabus. And smallpox is something which is also not in your syllabus, but a little brief about smallpox is that it was caused by this pathogen variola virus. And the type of organism was virus, which was causing this disease. And but now it has been eradicated, so it is the only disease, it's the only viral disease that has been eliminated from the world. So it was eliminated in 1980, and you do not need to remember anything other than this. Okay. So measles is no longer in your syllabus. You need to study cholera, malaria, HIV, and TB, and you need to know their causative agents, meaning the pathogens which are causing these diseases, and you need to know that which of the pathogen is under the category of the following organisms, meaning whether it is a bacteria or productis or virus. So you need to know this. Okay, this is very important for your MCQ's point of view. So number one is your cholera. Cholera is caused by Vibrio cholera, and it comes under the heading of bacteria, meaning Vibrio cholera is a bacteria. Then malaria. So malaria has 4 different species of Plasmodium, and when we'll study malaria, I'll let you know all 4 of them. Because they sometimes ask you to write the types of species of Plasmodium, so you can't skip this part. You need to know that Plasmodium is the causative agent of malaria, but you also need to know the names of all 4 of them. Okay. Then the type of organism Plasmodium is, it's Protoctus. It's not a bacteria, it's not a virus. It's a Protoctus. Then HIV or AIDS is caused by human immunodeficiency virus, and it's the virus. Then tuberculosis, it's a bacteria, and you need to know the names of both of them. You need the names of both of the pathogens: Mycobacterium tuberculosis and Mycobacterium bovis. You need to know the names of both of them. Okay. All right. So let's move on. So first disease that we'll be studying is cholera. We already studied that cholera is caused by a bacteria, and the bacteria is Vibrio cholera. And this disease is waterborne. So this is very important. You need to know how this disease is spread. It is a waterborne disease, and it usually occurs where people do not have access to proper sanitation, meaning clean water supply, or they are consuming contaminated food. Okay? So either they are living in poor living conditions where they do not have clean water or they do not have access to clean food. So either of this is the causative agent of this bacteria to be born, and usually it is born in water. Then you need to know the transmission. It's very important that to reach their site of action. So the site of action of this bacteria is your small intestine, and the bacteria has to pass through the stomach. And if the contents are sufficiently acidic, the bacteria are unlikely to survive. However, if the bacteria, yani this bacteria needs to pass stomach. And if the stomach is very acidic, then obviously it will be killed. But if it is not, and for some reason, if the bacteria is able to reach your small intestine, then they multiply and secrete a toxin called collagen. This is a very important name. You need to know this as well. That disrupts the function of your epithelium lining the intestine, so that salts and water leave the blood and ultimately cause severe diarrhea, and loss of fluid can be fatal if it is not treated within 24 hours. So it's a very, preventable sort of disease. You can administer ORS, you can administer oral rehydration therapy, you can provide the patient with glucose and salt water, and this is it. This is a very simple treatment. It is something which is controllable, and the treatment is very cheap. You need to provide solution of salts and glucose. You need to provide them oral rehydration therapy. Glucose is effective because it is absorbed into blood and takes iron. With it, it is important to make sure that the patient's fluid intake equals the fluid losses in urine and feces to maintain the osmotic balance of your blood and tissue fluids. So I hope this is not very difficult. It's easy. Then you need to know the prevention of cholera. That countries that have huge debts do not have the financial resources to tackle large municipal projects such as providing drainage and clean water supply to large areas of substandard housing. So basically, cholera is caused where they do not have proper living conditions. And it is usually caused in underdeveloped or developing countries where they do not have enough or sufficient financial resources. So, also the use of raw human sewage to irrigate vegetables is a common cause of the disease, as are inadequate cooking or washing in contaminated water. Areas of the world where cholera is endemic are West and East Africa and Afghanistan. Cholera is now almost unknown. Obviously, it's unknown because it's unknown in developed countries, but it's still endemic in the countries or continents which are lagging behind as a result of sewage treatment and the provision of clean pipe water, which is chlorinated to kill bacteria. So this is how you can prevent cholera um, by providing clean water and by making water chlorinated. The transmission cycle has been broken. Travelers from areas free of cholera to those with cholera is still endemic used to be advised to be vaccinated. So if someone is traveling from from a developed country to a country which is still endemic with cholera, they are asked to be vaccinated. Then we have malaria. So the causative agent, earlier I mentioned that you need to know the four species of this Protoctus plasmodium because sometimes they ask you to write two of them. So you need to know the name of Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria. So I'll advise you to learn all four of them, but two of them are, they are your bare requirement. You need to know two of them. Female Anopheles mosquitoes feed on human blood, so the transmission of malaria is extremely important, and the transmission of cholera is also important. They do give questions for 4 marks, and they ask you to write the transmission of any of the disease. So transmission question is always of 4 marks. You cannot skip this. So female Anopheles is your vector. Do not write the female Anopheles as your causative agent of malaria because I've seen students making this mistake. They get confused between causative agent and vector. So causative agent is something because of which the disease is caused, and vector is the vector is only the transmission. It only allows the transmission of disease. So female anopheles does not cause malaria, rather it transmits malaria from one person to another. So female Anopheles mosquitoes feed on human blood to obtain the protein they need to develop their own eggs. So what exactly is happening? There comes a mosquito. She needs certain sort of proteins so that her eggs could develop, and this is why she feeds on human blood. Number one. Then, if the person they bite is infected with Plasmodium, they will take up some of the pathogen's gametes with the blood meal. So if, for example, whomsoever she feeded on, and if that person is infected with Plasmodium, the Plasmodium will be sucked up with the blood. Then it will be sucked up in, this female anopheles. Then male and female gametes fuse in mosquito's gut and develop to form infective stages, which move to the mosquito's salivary glands. And when the mosquito feeds again, she injects an anticoagulant from her salivary glands that prevents the blood meal from clotting so that it flows out of the host into the mosquito. The infective stages pass from mosquito salivary glands into human's blood together with the anticoagulant in the saliva. The parasites enter the red blood cells of the human where they multiply. Then this is the remaining part. A vector is an organism which carries a disease from one person to another or from animal to a human. Do not confuse it with the causative agent, which in this case is plasmodium. So I already mentioned this. You need to know the difference between causative agent and the vector. Then malaria may also be transmitted during blood transfusion and when unsterile needles are used. Plasmodium can also, pass across the placenta from mother to fetus. Then the treatment of malaria is there are some symptoms that are associated with malaria that are fever, anemia, nausea, headaches, muscle pain, shivering, sweating, enlarged spleen. These are few symptoms of malaria. And anti-malarial drugs such as quinine and chloroquine are used to treat infected people. They're used as preventative drugs, stopping an infection occurring if a person is bitten by an infected mosquito. They are taken before these preventative drugs are taken before, during, and after visiting an area where malaria is endemic. So even if you do not suffer from malaria, you are advised to take these prophylactic drugs. These are preventative drugs, and you need to take them before you visit an area where this particular disease is endemic. Chloroquine inhibits protein synthesis and prevents the parasite spreading within the body. Okay. So this is what you need to remember chloroquine and quinine as the treatments for malaria. And there are also newer drugs such as mefloquine. It's expensive and it has some unpleasant side effects such as dizziness, vomiting, and disturbed sleep. Okay. So you need to know the name of three drugs. This is it. You do not need to remember all of them. Then the prevention for malaria could be by reducing the number of mosquitoes, avoid being bitten by mosquitoes, using drugs to prevent the parasite infecting people, which I already mentioned that you can take prophylactic drugs or preventative drugs. Then larvae hatch and develop in water, but breathe air by coming to the surface. So oil can be spreaded over the surface of water to make it impossible for mosquito larvae and pupa to breathe. And you need to sleep. You can also sleep beneath mosquito nets. And malaria was cleared from some countries. The program was not generally successful because Plasmodium became resistant to the drugs which were used to control it. And the migration of people from areas where malaria is endemic for economic and political reasons. Moreover, there is an increase in the number of epidemics because of the climatic and environmental changes that favor the spread of mosquitoes. Then we have HIV. So HIV/AIDS is caused by human immunodeficiency virus. HIV is a retrovirus, which means that its genetic material is RNA, not DNA. So it's a retrovirus. It's a very important information that initially it's a retrovirus. It has RNA instead of DNA, but to gain entry into human, it converts its RNA into DNA. This is why it is known as retrovirus. So once inside a host cell, the viral RNA is converted back to DNA Hence, it is known as retros in order to be incorporated into human chromosomes because we have DNA, we do not have RNA. The virus infects and destroys cells of your body's immune system. AIDS is not a disease, rather it's a collection of these, multiple diseases. This is why we call it that AIDS is itself, it's not a disease, rather it is an opportunistic diseases and associated with immunodeficiency caused by HIV infection. HIV is a virus that is spread by intimate human contact. There is no vector. Transmission is only possible by direct exchange of body fluids. In practice, this means that HIV is spread most easily through sexual intercourse, blood donation, and the sharing of needles. HIV is also transmitted from mother to child across the placenta through the mixing of blood during birth. A rare form of skin cancer, Kaposi's sarcoma, caused by herpes-like virus associated with AIDS. So they might ask you in MCQ that which of the cancer is associated with HIV. So you need to mark skin cancer or the actual name of skin cancer is Kaposi's sarcoma. Then the treatment is there is as yet no cure for AIDS and no vaccine for HIV. Drug therapy can slow down the onset of AIDS quite dramatically. The drugs are expensive and have a variety of side effects ranging from mild and temporary to the severe and permanent. And then there's this drug zidovudine. It binds to the viral enzyme reverse transcriptase and blocks its action. So they won't ask you this, but you need to know that there's no particular treatment. Only drug therapy can be administered, which only slows down the onset of AIDS disease. But there's no certain sort of treatment. Then how can we prevent HIV? By using condoms, femidoms, and dental dams are the only effective methods of reducing the risk of infection during intercourse, as they form a barrier between body fluids. Then there's also this methodology of contact tracing. It's an important part of controlling the spread of HIV. If a person who is diagnosed as HIV positive and is willing, first of all, he's willing, and then he's able to identify the people whom he or she has put at risk of infection by sexual intercourse or needle sharing, then these people will be offered an HIV test. Then last we have is TB. TB is caused by either of two bacteria, Mycobacterium tuberculosis and Mycobacterium bovis. It is spread when infected people with the active form of illness, cough, or sneeze, and the bacteria are carried in the air. So it is carried in air in tiny droplets of liquid. Transmission occurs when people who are uninfected inhale the droplets. TB spreads most rapidly among people living in overcrowded conditions. People who sleep close together in large numbers are particularly at risk. Again, if you are living in substandard conditions, you are at a risk of catching TB. The disease primarily attacks the homeless and people who live in poor substandard housing. The form of TB caused by M. bovis also occurs in cattle and is spread to humans in meat and milk. Then the treatment is the identification of the TB bacteria can be done very quickly by microscopy. If TB is confirmed, then patients should be isolated, meaning they should be put into quarantine while they are in the most infectious stage. The treatments involve using several drugs to ensure that all the bacteria are killed. If not killed, drug-resistant forms remain to continue the infection. The treatment is long. It can range from 6 to 9 months or even longer. Multiple drug resistant forms of TB, MDR TB now exist. And one of the main drug of TB is rifampicin, but they won't ask you this. You need to just know the basic treatment, basic prevention, and how it's caused. Then contacts are screened for symptoms of TB infection, but the diagnosis can take up to 2 weeks. The only vaccine available for TB is the BCG vaccine, which is derived from M. bovis, and it is usually administered to the infants, and you can see the mark of this BCG vaccine on your arm. So that is your BCG vaccine. It protects up to 70 to 80% people who receive it. TB can be transmitted between cattle and human. To prevent people catching TB in this way, cattle are routinely tested for TB and anyone found to be infected are destroyed. Then last subtopic which we have is antibiotic. Antibiotic is a drug that kills or stops the growth of bacteria without harming the cells of the infected organisms. They are derived from living organisms, although they're often made more effective by various chemical processes. So in bacterial cell, peptidoglycans are held together by crosslinks. You are already aware of this, that bacteria has a cell wall made up of peptidoglycan. Then penicillin prevents the synthesis of so penicillin is an antibiotic, and they're basically telling you the working of penicillin, that how it works by preventing the synthesis of these crosslinks between the peptidoglycan polymers in the cell walls of bacteria by inhibiting the enzyme that builds these crosslinks. This means that penicillin is only active against bacteria while they are growing. Why is it effective? Because it prevents the synthesis of the crosslinks between the cell wall. When a newly formed bacterial cell is growing, it secretes enzyme called autolysins, which make little holes in its cell walls. These little holes allow the wall to stretch so that new peptidoglycan chain can link together. Penicillin prevents the peptidoglycan chains from linking up, but the autolysins keep making new holes. So this particular enzyme is responsible to make little holes. Why is it making these holes? So that the walls could easily link with each other. But if any patient is administered with penicillin, then what will happen? Penicillin will prevent the peptidoglycan chains from linking with one another, but the enzyme will keep on making new holes. The cell wall therefore becomes progressively weaker because in those holes, peptidoglycan chains were not being able to link up, but the holes were, they were kept on, they were being made and made. So eventually the cell wall became weaker, and bacteria live in watery environment and take up water by osmosis. When they're weakened, the cell walls cannot withstand the pressure potential exerted on them by the cell contents, and the cell eventually bursts. So penicillin and other antibiotics do not affect viruses. Why? They do not affect viruses because obviously viruses are different organisms, and initially, if they're not into their host, they are considered to be non-living. And also, virus keeps on changing itself, it keeps on mutating itself. So, any of the drugs for viruses, they can't control viral infections. Even antivirals can't control viral infections because virus has this ability to change itself. Then antibiotic resistance can arise when an existing gene within the bacterial genome changes spontaneously to give rise to a nucleotide sequence that codes for a slightly different protein that is not affected by the antibiotic. Okay. And what else? Yeah, this is important. Plasmids. So plasmids are found in your bacteria. They're quite frequently transferred from one bacterium to another in the processes of genetic engineering, even between different species from bacteria to human. This happens during conjugation when a tube forms two bacteria to allow the movement of DNA. During conjugations, plasmids are transferred from a donor bacterium to a recipient. Transfer of part of DNA from the bacterial chromosome also occurs this way. This method of transmission is called horizontal transmission. So, when plasmids are transferred from a donor bacterium to a recipient bacterium, meaning the plasmid is not transmitted to the offspring of bacteria, rather it is transmitted in a horizontal manner, meaning this was bacteria A and this was bacteria B. And if the plasmid of bacteria A was transmitted into bacteria B, then this is horizontal transmission, not the vertical transmission. Vertical transmission takes place between parents and offsprings, all right? So you need to be sure that what is meant by horizontal transmission. Horizontal transmission, again, I'm repeating, it is when the plasmid of bacteria A is transferred to bacteria B. Okay? Then using it, okay, so how they might ask you this question, that how can antibiotic resistance be prevented? Then by using antibiotics only when appropriate and necessary, and when they are prescribed by your doctors, and by reducing the number of countries in which antibiotics are sold without doctor's prescription, and by making sure that patients do not keep unused antibiotics for self-medication. And this is it. They might only ask you to write three reasons or three pointers of how antibiotic resistance can be prevented. You have another ones, um, but this is it for your syllabus. And Jazakallah khair for joining. We have completed your AS level biology's entire syllabus. You have the recordings of the entire syllabus. You have the recordings of your past papers. Make sure to look at the recordings again and again, and you can drop a comment if you have any difficulty. And good luck for your exams. Jazakallah khair. Take care. Allah Hafiz.